Good afternoon, and thank you for the opportunity to share our work. I'm Edward Cole, CEO of KATLAS Technology. Today, I'll introduce IntelCierge, a trusted intelligence platform that connects hospital, pharmacy, and home care through verifiable, energy-efficient digital continuity. Our goal is simple: to make every transition from hospital to home safer, faster, and truly patient-centered. Every hospital discharge triggers a chain of handovers to GPs, pharmacies, community nurses, and home care providers. Yet these systems rarely talk to one another. And that lack of digital continuity means delays, duplicated effort, and sometimes avoidable harm. The NHS has recognised this in its 10-year plan. It needs hospital-to-community continuity, not isolated records. And today those gaps cost more than $400 million a year in delayed discharges and readmissions, while clinicians spend up to a third of their time simply reconciling fragmented information. To enable prevention and predictive care, we need verifiable, trusted data at source. The NHS has already defined its direction, the three big shifts that will shape the next decade of care. From hospital to community, meaning care must continue seamlessly beyond the ward. From analogue to digital, replacing paper and phone calls with real-time, verifiable data exchange. And from sickness to prevention, using trusted insights and foresights, of course, to detect risk earlier and keep people well. IntelCierge was designed precisely for this moment, enabling these shifts through a verifiable, privacy-preserving digital fabric that connects every part of the care journey. IntelCierge introduces a new kind of digital fabric, one that builds trust without centralizing data. It's based on three simple principles. First, trusted continuity. We exchange proof, not payloads, meaning sensitive patient data stays at source, doesn't move, while clinicians retain full control and verifiable audit trails. Second, interoperable intelligence. The system integrates easily with NHS, pharmacy, and community platforms through an open source governance layer designed for scale. And third, privacy-preserving automation, peer-to-peer smart workflows, and local AI agents validate information safely and efficiently without exposing personal data. And together these create a wallet-based, trusted data exchange for federated health systems, secure, scalable, and ready for real-world use. Behind IntelCierge is a platform built for assurance as much as innovation. Our architecture already supports verifiable coordination across hospital, pharmacy, and community settings, with full provenance from design to deployment. Each operator acts through trusted credentials, ensuring authority and accountability across workflows. And on the data side, our federated trust fabric links existing NHS systems without centralizing ownership. Data stays where it belongs, yet remains verifiable. In short, IntelCierge provides a common trust layer that enables digital continuity and scalable innovation safely and compliantly. Here's what IntelCierge looks like in practice. Each care partner, the GP, specialist, pharmacy, home care provider, even wearable devices, connects through a trusted care layer. At the center is the patient wallet, a self-sovereign space where information is shared as verifiable proofs, not raw data. This means updates, consents, and discharge notes flow securely and instantly between settings without losing privacy or control. And behind the scenes, each node, from smart automation to dashboards, runs on our cryptographically secured, decentralized architecture. For patients, this means safer, more joined-up care, and for clinicians, fewer reconciliation headaches and real-time assurance that data is authentic. The foundation of IntelCierge is already proven and deployable. At its core is KATLAS Net, our Layer 1 trust fabric, a secure, verifiable, and energy-efficient infrastructure that underpins auditable data exchange without central control. Our wallet protocols bring self-sovereign governance to the edge, enabling consent-driven sharing, while our DevOps suite ensures every build is reproducible and compliant by design. And finally, our SLM agents, small language model agents, push intelligence to the edge, analyzing safely on device, so insight happens in real time without moving sensitive data. In short, Trust here isn't added after the fact, it's embedded in the computation itself. What's powerful about this foundation is that patient journey doesn't exist in isolation. Across our deployments, from freight to travel, we've been building the same self-sovereign intelligence layer. In logistics, we enable secure data exchange for multimodal freight. In mobility, traveller wallets manage consent-based access across stations and infrastructure. And now in healthcare, those same principles support verifiable, privacy-preserving continuity of care. And together these demonstrate how IntelCierge isn't just a product, it's a proven framework for trusted journeys across sectors. So looking ahead, our next step is about partnership and validation. We're co-designing clinical pathways with NHS partners using IntelCierge wallets and dashboards, starting where continuity matters most, at the point of discharge and in community follow-up. Our live pilots will validate digital continuity across hospitals, pharmacy and home care, proving that trusted data exchange doesn't just improve coordination, it also reduces avoidable readmissions and an administrative burden. And to scale responsibly, we're engaging with the Founders Factory, the Hill and NIHR, aligning innovation with NHS frameworks for safety, assurance and value. The KATLAS team brings deep technical and operational experience across cryptographic security, enterprise AI and real-world deployment. So what we're proposing here isn't theoretical, it's already proven in adjacent sectors. And beyond that, we're developing our partner integration network, a digital twin as a service layer that allows other innovators to plug into the same trust fabric. And that means partners can build new tools, new pathways, and new business models, all with verified data provenance and shared savings, aligned to NHS net zero and innovation goals. IntelCierge isn't just another data platform, it's a foundation for care that understands the whole person. It learns from what you eat, how you sleep, your habits, your rhythms, but does so privately and on your terms. And because in this new world of personal agents, the future of healthcare depends not on owning data, but on earning trust. And together we can make connected care safe, simple, and truly personal. Thank you.